ثم تشتغل بمطلع.
طلاب ولد الممثل يقول الطلاب راح يلوموني لأنه أنا بلغتهم بس الهارت اكسترنال مورفولوجي وبريكارديوم. حقيقة يعني من حقهم تلوموا. هو قد يكون كان محاضر ومنتبه على هذه السواد بالمحاضرة. أنا بالمحاضرة طلعت الكوريكولم، جدول بالمحاضرات العملي والنظري، وقلت لكم ترى انتم ما تفتهمون شلون دا يصير التدريس العملي، ترى هيك وهيك، بس احنا مختبر الجاي لانه صارت عطل راح ندمج القلب كله يوم الاحد والاثنين والميديستانم يوم الثلاثاء والاربعاء، دمج كلها لانه صار حكينا. يجي هو يجتهد من كيف، هاي مسؤوليته. تجون انتم تمشون بحكي لان اسهلكم وتمشون بحكي كيف. فاليوم درسنا هو بريكارديوم اند هارت. طبعا هو جزء راديولوجي موجود بالمحاضرة، ما جبت انا اشعه، ترى كان المحاضرة راح اشرح لك نماذج بلاستيك وريل على الهارت بريكارديوم، بس أنا من حقي بالامتحان العملي طلع صورة من المحاضرة فيها شيء على شعر وأشير لك عليه. سأل شلون تروحين؟ أنا أفضل إنه نشرح الأجزاء وبعدين نروح على الكلام أحسن، على مود تصير صورة ثابتة. حلو، يعني نشرح هيك وبعدين الجثة نوقف ومو انتم توقفون البدين. ماكو مشكلة، ماكو مشكلة. عين ماكو. منو محمد؟ يعني عندهم درس لو شنو؟ اوكي. لا دقيقة. Our session today is about the heart, external morphology, inside of the heart, and pericardium. In order to study the external morphology of the heart, you have to look to the heart from the anterior aspect, as you can see in the anatomical position. At that aspect, I must say that the right border of the heart is formed by the right atrium, and the left border of the heart is formed by the auricle of left atrium and left ventricle, and the inferior border of the heart is formed by the right ventricle and left ventricle. I can see here between these borders the anterior surface of the heart. It shows the right atrium and the auricle of right atrium. It shows the right ventricle separated from the left ventricle by the anterior interventricular groove that contain the anterior interventricular vessels and the great cardiac vein. And you can see that the right ventricle ends above by the pulmonary trunk. And on the right side of the pulmonary trunk, this is the ascending aorta projecting from the left ventricle. In addition to this surface, which is the external surface, which is the anterior external surface, I'm going to look to the heart from inferior, and that is the inferior surface of the heart. It shows the left and right ventricles separated by the posterior interventricular sulcus, which contain the posterior interventricular artery with the middle cardiac vein. And also, in addition to the inferior surface, which is also called diaphragmatic surface, and the anterior surface, I may look to the heart from behind. And then I will see the left atrium forming the base of the heart with two pulmonary veins on that side and two pulmonary veins on that side. This is all about the external morphology, considering the borders, seeing anteriorly the anterior surface, inferior surface, and posterior surface. I may see the superior vena cava entering into the right atrium, the inferior vena cava entering into the right atrium. Before passing into the inside of the heart, we could from the outside see also the vessels. This is right atrium, this is right ventricle, and in between them this is the atrioventricular groove, or called coronary sulcus. The sulcus is seen anteriorly, so it is the anterior coronary sulcus. And because it is between the right atrium and right ventricle, so it is the right anterior coronary sulcus. It contains the main trunk of right coronary artery. The right coronary artery projects between the auricle of right atrium and pulmonary trunk. And then it descends in the anterior coronary sulcus, giving at the lower border of the heart marginal branch. Then the right coronary artery turns posteriorly to be in the right posterior coronary sulcus. After that, it gives posterior interventricular artery, 90% of population, and then anastomose with the circumflex branch of left coronary artery at the crux, at the crux of the heart. Returning back to the anterior surface. In between the left auricle and the pulmonary trunk, this is the left coronary artery. It is a very short trunk that soon it divides into anterior interventricular artery that run with the great cardiac vein and the anterior interventricular sulcus separating the left ventricle from the right ventricle. And also the short coronary artery will give the circumflex coronary that passes posteriorly and the left posterior coronary sulcus to end in the crux, anastomosing with the distal end of the right coronary. So this is the circumflex coronary branch of left coronary and the posterior coronary sulcus. The coronary sulcus separates the left atrium from the left ventricle, and it is posterior, so it is left posterior coronary sulcus. The seam of this sulcus shows with the circumflex coronary artery a vein, which is the coronary sinus. The coronary sinus shows many tributaries, including the middle cardiac vein, including the posterior vein of left ventricle. Maybe you may see here the oblique vein of Marshall, but it is not demonstrated. And you can see that the coronary sinus here draining the middle cardiac vein running with the anterior interventricular artery. I can see here with the marginal branch many veins. These are the anterior cardiac veins that drain directly to the right atrium. And by that, we had finished external morphology and borders, vessels of the heart, including arteries and veins. And I'm sure you have to come so close to the sample to study in details these structures. And now I will pass to the inside of the heart. And I will remove this anterior surface. Just remember that this anterior surface shows right atrium and right auricle, right ventricle and part of left ventricle. This is pulmonary trunk, this is ascending artery. When I remove the anterior surface, I will see the inside of the right atrium. Although it is not so clear to show the rough and smooth part of the inside of the right atrium, but you can imagine that the posterior wall, which is this one, is the smooth part, which is sometimes called sinus venarum, containing above opening of superior vena cava and below opening of inferior vena cava. And from the right atrium, I may pass to the right ventricle, and this is the position of the tricuspid valve. This is interventricular septum, and this is left ventricle. And this is papillary muscle with chorda tendini connected to the cusp of mitral valve, and this is the cavity of the left atrium. This is the ascending aorta, this is the pulmonary trunk. I will pass to another sample, which is also a plastic sample. Again, the same description. This is the anterior view of the heart. I can see that the right border of the heart is formed by the right atrium. The left border of the heart is formed by the auricle of left atrium and ventricle. The inferior border of the heart is formed by the left ventricle and right ventricle. These anterior borders or borders seen on the anterior view, bounding the anterior surface, which is formed by the right atrium and the right auricle, right ventricle, left ventricle, and the auricle of the left atrium. Again, this is the pulmonary trunk above the right ventricle. This is the ascending aorta, that is the superior and inferior vena cava. Again, this is the anterior right coronary sulcus containing the right coronary artery. These are the anterior cardiac vein. This is the anterior interventricular artery with the great cardiac vein. This is the circumflex artery with the coronary sinus. This is the posterior vein of left ventricle, and this is the middle cardiac vein. This is the base of the heart formed by the left atrium and 4 pulmonary veins. This is the inferior surface formed by the left ventricle and right ventricle, separated by the posterior interventricular artery. With it run the middle cardiac vein, which is a tributary of the coronary sinus. This is inferior vena cava. And if I remove the anterior wall, I will see the inside showing papillary muscles and chorda tendini, although they are not so real. But for example, these are ridges in the left ventricle. See, these are trabeculae carinii. This is interventricular septum. This is the valve of the pulmonary trunk, so it is pulmonary seminal valve. There are many structures to be demonstrated here. You have to look to it closely when I finish the session, using your knowledge. Anatomy in lab means interpreting the theory on samples. Now we will pass to the real heart. This is the anterior surface or anterior view of the cadaveric heart. Again, the right border is formed by the right atrium. The left border is formed by the auricle of left atrium and left ventricle, while the lower border is formed by the left ventricle and right ventricle. So this is the anterior surface of the heart. It is formed by the right atrium with the auricle of right atrium. It is formed by the right ventricle, left ventricle, and it is formed by the auricle of the left atrium. On that view, I may see in between the left ventricle and right ventricle the anterior interventricular artery. With it, the blue one is the great cardiac vein. The sulcus between the right atrium and right ventricle is called the right anterior coronary sulcus. Above the right ventricle, this is the pulmonary trunk. Between the pulmonary trunk and the auricle of right atrium, you may see here beginning of the right coronary artery. You have to look to it closely. Right. And also between the left auricle and the pulmonary trunk, you may see the left coronary artery. That soon divides into anterior interventricular branch and circumflex branch. On the inferior surface, this is the left ventricle and right ventricle, and between them, this is the posterior interventricular sulcus containing the posterior interventricular artery with it the middle cardiac vein. This is the left atrium opened, and this is the left ventricle, and in between them is the left posterior coronary sulcus containing the coronary sinus and the left circumflex branch of left coronary artery. If I open the heart from inside, I have to open the heart and study it, but again and again and again, you must remember, don't ever study the heart without putting it in anatomical position, which is the anterior. This is the right atrium, right ventricle, left ventricle, and that is the auricle of the left atrium. So now I will open the right ventricle. This is it. You can see the trabeculae carinii in form of ridge bridge and trabeculae muscles and papillary muscles. This is the papillary muscle. It is attached by cord attending to the cusp of a tricuspid valve, and that is the moderator band. There are many papillary muscles to be seen. Some of them are anterior, one of them is posterior, and the other are small septal. Again, I will open the apex of the heart, which is the left ventricle. And again, I will see trabeculae carinii papillary muscles connected by chorda tympani to the cusp of mitral valve. Just look to the wall of the left ventricle. It is much thicker than the wall of the right ventricle. Now I will pass to the right atrium. I will open it. This is it. The anterior wall of right atrium shows the pectineal muscles, while the posterior wall and septal wall are smooth. The septal wall shows the fossa ovalis, which is the septum. طلع برا بالممر. Right. So we had finished the inside of the right atrium, right ventricle, left ventricle. The left atrium is also opened here. The only smooth, rough part of it containing pectoral muscle is the auricle. I may see here a section into the heart, ventricles of the heart. You can see the left ventricle is circular, while the right ventricle is semilunar. You can see the interventricular septum. You can see how the left ventricle is thick in its wall, while the right ventricle is thin. You can see many trabeculae carinae. Other samples contain the same information, and you have to follow it by yourself. This is the right coronary artery. This is the marginal branch of right coronary artery. This is the anterior interventricular artery. This is the circumflex branch. And this is the coronary sinus. Try to see these samples. وياكم دكتور عبد الله. وقعكم بس البريكارديوم. بس جيب الكاميرا هنا. I try to arrange things as they are real. This is the pericardium. It is the fibrous pericardium. If you open it, you can see that this fibrous pericardium is glistening from inside because this is the serous parietal pericardium. And the heart itself is also glistening because this is the viscerous serous pericardium, which is called epicardium. And inside the pericardium, you may see the pulmonary trunk, the aorta, the superior vena cava, as structures of the pericardium or inside of the pericardium. Again, you have to look to it closely. It's impossible to see it on camera. الساعة 12:30 الوحدة نسوي جلوكوز.